But I'm very pleased to announce our public access defibrillator program, which is really aiming to make sure that there are even more defibrillators in accessible places and in competent hands who can make sure that those of us who may have a cardiac arrest will actually have the very best chance of life. Today we're here with, and I've already met some of the SES, State Emergency Service representatives, and the Volunteer Rescue Association representatives, two very, very important organisations who are very frequently the first on the scene in situations where perhaps we wouldn't think that an SES or VRA officer might be there when there's a medical circumstance. But just talking to some of the staff here just from the VRA, they were telling me that in around about 40% of all the cases they attend, there is actually a medical issue that is part of their Volunteer Rescue Association response. What that tells us is the more opportunities we have with the amazing people in our community who form those rescue services, the SES, and possibly as we move forward even other services, including I'd like to see more discussions with the Rural Fire Service, Fire Brigade and so on. We will see more and more people who can actually respond very, very quickly to ensuring that there is a defibrillator and a very competent set of hands to make sure that CPR is there for you. So today is a very, very important day for the New South Wales community. What it is telling us is that we are bringing our rescue services together to be able to work in a way that has never happened before, and that is really aiming at making sure that every member of the community who might have a cardiac arrest outside a hospital has the very best chance of life. I want to thank the senior officers and senior executive of the VRA and the SES who have worked so closely with Dom Morgan, Commissioner Dom Morgan from New South Wales Ambulance and his paramedic teams to ensure that they are well trained. Each of the people who are taking part in those other organisations are well trained to be able to do the CPR that is so critical for those 8,000 people outside the hospital. Defibrillators have been rolled out broadly by the New South Wales Liberal National Government, particularly in the last few years. We've been trying to facilitate through a number of programs getting defibrillators into the hands of community groups. I would just say to all those community groups, again, it's great to have a defibrillator, but it's very important that as many people as possible in your community organisation also learn CPR. CPR is the golden way of making sure, along with the defibrillator, that we have every chance of keeping our community members alive when they happen to have a cardiac arrest.